And hospitals aren't the only industry struggling. Some schools and daycares are facing the same exact staffing shortages. And a few sick calls can be the difference between being open or closing for the day. And more are closing their doors for good. KCTV5's Carolina Cruz joins us live now with a closer look at the impact that this is having on families. Carolina?
Well, none of the 3 child care centers that I spoke with are confident that they can stay open if things continue the way they are. About 30% of child care centers in the metro have had to close permanently during the pandemic.
It's just a perfect storm.
Cindy Lenoff is the director of the National Child Care Association. About 80% of all early childhood centers nationwide are short-staffed, leading to long wait lists for children.
It's catastrophic, and the worst is we haven't seen the worst yet. Because right now, a lot of centers are at least getting some support from the stimulus packages that were passed.
Centers like Sweet Chariot Child Care Center. The facility serves mostly lower socioeconomic families.
If we shut down, the children lose a place to go during the day, parents lose their job, and then we're dealing with a whole bunch of more poverty, and we need people to come up. And that's why we're here to help them come up.
The center is only one of about 2 in the area that's already seen more than a handful of closures. Armand McDonald Sr. says he fields at least a few calls daily from parents asking if they have openings. With a small staff, 1 COVID sick call is all it takes for his facility to have to temporarily close.
Can't afford that. No, not in this time, no.
Other centers like Early Start, formerly known as United Inner City Services, was forced to close all 3 facilities after their return from winter break because of COVID-19.
Over the weekend prior to us reopening, we've gotten word that several of our staff had tested positive or were waiting for test results. So we're calling this kind of our ground zero level set, and asking families to watch their children closely, get them tested as needed, and the same with our staff. And we're just wondering what the next days and weeks are going to hold.
During the pandemic, they took over 2 buildings, one of which housed a child care center that had to shut down.
We close our doors at either of those facilities, we'd be yet another provider closing.
We as child care providers and professionals, we're the essential workers that allow for all other essential workers to go to work. And I think sometimes that's forgotten.